Hi everyone, my name is Dr. Sandeep Dube. I am a cardiologist with Community Health Network, and I am also the physician executive for the cardiovascular product line and the Heart Hospital. February is American Heart Health Month, a time where people can focus on their cardiovascular health. Today, we are going to talk about heart health, why and when you should get a heart scan, and discuss the current recommendations for heart screening. My goal is to help you understand how the screening process works and learn about the risk factors for coronary artery disease. Now, let's get started. Patients often ask me, what is a heart scan or cardio score or calcium score to understand how cardiologists assess a person's risk of cardiovascular events such as heart attack or heart health event. I'm going to explain how we use heart scans and cardio score and why these numbers are so important for patients to understand. Heart scans provide physicians with a patient's cardio score, a diagnostic test that measures the amount of calcium or heart plaque in a patient's heart coronary arteries, which is used to educate patients and recognize the risk for developing coronary artery disease. Coronary artery disease is a very common condition. In diseased condition, the major blood vessels that supply the heart, which are called the coronary arteries, struggle to send enough blood, oxygen, and nutrients to the heart muscle. Cholesterol deposits or plaques in the heart arteries and inflammation are usually the cause of coronary artery disease. Signs and symptoms of coronary artery disease occur when the heart doesn't get enough oxygen rich blood. If you have coronary artery disease, reduced blood flow to the heart can cause chest pain, which is called angina, shortness of breath, and sometimes other symptoms. A complete blockage of blood flow can cause a heart attack. Coronary artery disease is the leading cause of death for men and women both in the United States, and that's why we are all concerned about this disease. Coronary artery disease often develops over decades, and sometimes silently. Symptoms may go unnoticed until a significant blockage causes problems or a heart attack occurs. A heart scan can help predict the likelihood of a cardiovascular event such as a heart attack and potentially save your life. Again, people ask me, are you a good candidate for heart scan or who is a good candidate for heart scan? So, if you are a male over 40 years or female over 50 years age and have risk factors like high blood pressure, diabetes, obesity, high or borderline cholesterol, are a smoker and or have a family history of heart disease, then you may be qualified candidate for a heart scan. If you think that you are at a higher risk for heart disease due to family history or other risk factors, talking to your doctor can also help. Your doctor can check your blood pressure and cholesterol levels and conduct a range of cardiac screening tests to give you a clearer picture of your risk. The heart scan is performed in a CT scanner. It typically takes about 15 minutes to complete and is gated for low radiation exposure. EKG pads will be placed on your chest and will not require removal of clothing. The heart scan is a non invasive procedure and completely painless. On the day of screening, you should plan to wear loose clothing. Be sure that all undergarments are without any metal clasps or wires. Avoid wearing jewelry on the neck or near the chest, but rings, watches, and pacemakers are acceptable. During the scan, you will lie back on a platform that actually slides into the CT scanner. You will need to lay still and might be asked to place your arms above your head. You will be asked to hold your breath for very short periods. Electrodes will be placed on your chest to record your heartbeat. How often is heart scan performed? So, heart scan frequency will depend upon the heart score, your age, and other risk factors. Cardio score can vary from 0 to 1000 or more, and cardiac risk is based upon age, sex, and your cardio score. Patients with low cardio score, which is 0 or close to 0, can repeat it every 5 years. Patient with moderately elevated cardio score up to 400 should see their primary care physician or if they have a cardiologist for treatment advice. Patients with high cardio score more than 400 are offered an appointment to see a cardiologist after their test. How do I set up a heart scan? So, if you are interested in setting up a heart scan, patients can self schedule screening online or by calling Community's centralized scheduling line, which is 317 355 4680. Schedulers can answer your questions, connect you to a CT technologist, and schedule your scan. Heart scans are typically not paid by insurance. Our community health network subsidizes the scans, which cost patients $49 each. Fast CT scan is analyzed by a software that prints out a number called the cardio score that is available within a few minutes after the scan is completed, and it's given as a printout to the patients that they can take home with them. And detailed results will be available in my chart within 24 to 48 hours. If you do not have my chart, results will be mailed to you within 5 to 7 days. Coronary artery disease is largely a preventable condition. Your physician can use the cardio score or calcium test results to determine if you need further cardiac testing, medication, or lifestyle changes to reduce the risk of heart attack or other heart problems. You should regularly discuss your history and symptoms with your primary care physician. Screening tests are for asymptomatic patients who have risk factors. If you are actually having chest pain or other symptoms, depending upon the severity, call your physician immediately or seek attention in the nearest emergency room. And a few tips from a cardiologist. Heart health screening tools are amongst many options available to help you prevent heart disease and live a long and healthy life. What you eat, how much you move, whether you smoke, controlling your cholesterol and blood pressure are five things that can have a big impact on your heart and general health. Remember that regular physical activity reduces your risk of having a heart attack or developing heart disease. So go out there and start living.